In this video, we'd like to talk about Antai Hospital's management for ectopic pregnancies, and it's different than conventional hospitals' management method as well. So we'd like to emphasize that here at Antai Hospital, we refrain from engaging in organ removal. So conventional treatment, conventional approach for ectopic management is that they will remove the affected fallopian tube. Now this can cause complications, reduce your fertility, and to be honest, it's very invasive and very destructive, and it's unnecessary. Here at the hospital, we offer you a different approach that can allow you to preserve your fallopian tube, and you can get naturally pregnant after receiving treatment with us. So ectopic pregnancies are pregnancies that implant in the wrong area. So a pregnancy is only allowed to implant in the endometrium for it to develop healthily. Anywhere else, and it can cause a potential miscarriage. So anywhere else that is implanted, for example in the cervix, in the fallopian tube, the pelvic cavity, even on the fundus of the uterus, all of these are ectopic pregnancies. But by far the most common one that we see is a tubal pregnancy. And this happens so commonly, it's because fertilization occurs in the fallopian tube. So if there's any problems with the fallopian tube, it may very well affect the delivery of the fertilized embryo. So it will directly implant itself in the fallopian tube. So ectopic pregnancies are considered emergencies, critical emergencies, because if they are not diagnosed properly, they're not caught early, if they are not dealt with earlier, if the pregnancy is allowed to progress and develop, can cause a tubal rupture, which may lead to massive internal bleeding and potentially threaten the mother's life. So it is something that we need to put a lot of emphasis in and do the quickest treatment to both preserve organ function and also save the mother's life. So Antai Hospital's treatment for ectopic pregnancies is a very precise, specialized treatment that we use both 3D laparoscopy and hysteroscopy. So let's say if you do have an ectopic pregnancy that's happening and this embryo is implanted in the fallopian tube. So first of all, we need to diagnose at the same time when we remove this pregnancy. If it's an inevitable miscarriage, if we cannot save the pregnancy, then we need to terminate it by removing it surgically. But we want to preserve the organ function. Now this is the difficult part here, but we can do this. So what we do here is that we want to use a Cook guide wire that we guide into the fallopian tube. This can allow the fallopian tube to stop sticking itself together, and after that we will place a stent to prevent any adhesions forming afterwards. So this can allow the fallopian tube to recover over time and also prevent it from closing back again. So this procedure alone can prevent you from losing a fallopian tube. Another option that we provide for our patients is that if you do have intentions to preserve this pregnancy, let's say you do want to keep this pregnancy, and if it's possible that we can do this, then we offer you another specialized procedure where we call it the Embryo Transplant, where we can, our doctors have the specialized skill to actually remove the embryo from the fallopian tube and implant it into the uterine cavity. This way the embryo is allowed to develop properly and you don't have to lose your fallopian tube as well. This entire procedure also involves other patented techniques. For example, our Adhesion Barrier, which is a very important component of this procedure because it boosts healing and also prevents adhesions, and it can stop the fallopian tube from closing again. This treatment that we offer here is especially important for women who have already lost the fallopian tube, because they only have one fallopian tube left. So if you do have it blocked again, another ectopic pregnancy has happened again, most doctors will actually remove it, and then you will become permanently infertile, unable to have a natural pregnancy. That's why here at Antai Hospital we put emphasis in organ removal prevention. We don't need to do all these unnecessary invasive procedures. Antai Hospital has a better way that not only protects the mother's life but also retains your organs and also its function. And we secure you a full-term natural pregnancy after receiving our treatment. So if you'd like to find out more information, or if you are interested to receiving treatment with us, please check our website and schedule an online consultation today.